assignments and safety, number location of the patient, one patient here on a car accident. MOI to the trauma, considering C-spine. My partner's gonna hold, maintain C-spine. But we get a phantom C-spine, a person to hold phantom C-spine. Person's holding it. We're gonna call for additional resources. I'm also gonna measure the C-collar by my fingers on her neck and I'm gonna properly position it in adequate function.
Ma'am, what's your name and age?
My name is Mary, and I'm 35 years old.
Do you know what happened today?
I was just driving and a car came out of nowhere.
Do you know what day it is?
It's January 21st.
Our patient is A0 times 4.
We're going to properly position the C-collar on her neck and then strap it in. Based on the general impression, the patient was hurt and distraught due to bleeding in her arm. So what we're going to do is we're going to treat her major life threat and any other major bleedings that could be at this time. In order to do this, we're going to take her out of the vehicle. While we're going to do this, I'm going to go from behind her arms and my partner is going to be grabbing her from her legs, and on the phantom heads count, we're going to all lift up together and move her to the backboard, which is on the floor here. So on 3, the phantom, 1, 2, 3. And lower her. We're going to strap her in, cross diagonally, strap her legs, tie her feet together, strap her head. She is now secured to the backboard.
We're now going to treat the major bleeding. First, we are using a 4x4 gauze and holding direct pressure. The bleeding continues. We use another 4x4 gauze and add direct pressure, and the patient is still bleeding. We'll now use direct pressure at the arterial point, at a pressure point, and the bleeding still continues. At this time, I'll ask the phantom EMT to hold the arterial pressure point and elevate the arm.
We will do so by putting something underneath our arm to stabilize it.
What? Tourniquet?
So we're also going to treat for shock by elevating her legs, which is shown here. We're also going to put a blanket over her to properly position her for shock and to preserve heat while exposing the arm.
The tourniquet goes above the joint and tightening it enough to make sure it's secure. We're then turning it off the way until there's no more bleeding and the distal pulse is gone. There is no distal pulse. We'll now write the patient's name, date, and time on the tag.
My partner and I come over here to the pulse. We're going to attach an SpO2 to their finger as well as some blood pressure cuff.
Beginning with the airway, the patient is talking, so her airway is open and patent. She was speaking to us, so we're ruling out the use of an adjunct. For breathing, we're going to check her respirations, rate, rhythm, and quality. For 60 seconds, her respirations come back at 23. We're making sure there's nothing compromising her breathing. At this time, there is nothing compromising her breathing.
We're also going to provide proper ventilation and also oxygen therapy at this time.
We'll be checking her pulse on the arm that does not have a tourniquet. For 60 seconds, her pulse comes back at 68. We're checking her oxygen intake with the SpO2. Pulse oximeter comes back at 93.
So in order to treat this oxygen therapy, we're going to administer nasal cannula, 15 liters per minute, to our patient to give them oxygen they need. We're going to check the O valve, make sure it's functioning properly, check for any leaks and or cracks in the oxygen tank. There isn't, so we're going to attach it.
I'll be checking the blood pressure on her arm as well, making sure the stethoscope is at her artery.
Putting the nasal cannula on her. And then resting it in between her feet.
Blood pressure comes back at 118/73.
Now what we're going to do is, this is a high priority patient. We're going to treat her. We're going to reassess her every 5 minutes. We're going to transfer her via ambulance. And now we're going to go into sample and OPQRST. Ma'am, what were the signs and symptoms? What were you feeling when this first happened?
I felt pain in my left arm.
Are you allergic to anything? Any allergies?
Peanuts.
Peanuts, medications. You taking any meds recently?
No medications.
Past medical history. Is there anything that happened that was kind of related to this?
No.
No. Last oral intake, what was the last thing you ate or drank?
Salmon.
Salmon. Events leading up to, what was happening before you started getting hurt like this?
I was just driving my car and a car came out of nowhere and hit me.
Okay, so OP Curtis T.O. onset. What were you feeling when this race happened?
Sharp pain in my left arm.
Sharp pain. Okay, P provocation. Does anything make it better or worse?
Just moving it.
Moving it makes it worse. Okay. Q quality. What type of pain is it? Is it like sharp? Is it dull? Is it throbbing?
It's pretty sharp.
Pretty sharp. Okay. R radius. Does it radiate anywhere? Does it remove the pain?
It moves up my shoulder.
Up your shoulder? Okay. F severity on a scale from 1 to 10, 10 being the worst that you could possibly feel. What's your pain at?
I would say 9.
9? Okay. T time. How long do you think this is going on for?
Few minutes.
2 minutes?
We'll now be performing a rapid head to toe. We'll be looking for decap BTLS, which stands for deformities, contusions, abrasions, burns, punctures, tenderness, laceration, and swelling. Starting at the stop, we're inspecting that is all intact, no bleeding or damage. We're checking the ears for any spinal fluid. We're checking her eyes for pearl, which means pupils are equal and reactive to light. We're checking her facial bones are intact, her nose area is fine. We're checking her mouth for any foreign body obstructions, any mouth odors that are unusual. Before we put the C-collar on, we checked for stair stepping in the back of her neck. We checked for JVD, jugular vein distension, and tracheal deviation. We also, before we put her on the backboard, we checked that her back was cervical and lumbar for decap BTLS, as well as her bottom. We checked her clavicles for decap BTLS and making sure they're intact. We're checking her chest. We're inspecting, auscultating, and palpating. Moving to the abdomen, we're looking for soft, non-tender using a wave motion and for all 4 quadrants. If this were a male patient, we would check her priapism. We're also checking that her pelvic is intact and decap BTLS. For her lower extremities, we're looking for decap BTLS and pulse motor sensation. Pulse, motor, can you feel this? Can you move this?
Yes.
On the opposite extremity, PMS, there's a pulse. Can you move this? Can you feel this?
Yes.
We're checking her upper extremities. We're checking for PMS in the hand. We're looking for a pulse. There is. Motor, can you squeeze my fingers? Sensation, can you feel this?
Yes.
We will not be doing PMS on the hand that has the tourniquet, but we're still checking that there is no pulse. There is no pulse.
We are also going to be checking for any secondary injuries that may have occurred or are present this time. We don't see any. We're also going to reassess this patient every 5 minutes due to being a high priority patient. We're going to continue to monitor, or for intervention, we continue to monitor her breathing, her oxygen with the SpO2 to make sure that she's adequately being supplied oxygen. And we're going to continue to monitor the arm that has the tourniquet to make sure that there's still no pulse present, and we are going to continue to treat for shock so we can deal with the hyperperfusion that has occurred because of blood loss.
We're still continuing verbal and nonverbal communication with our patient, letting her know we're taking care of her. We'll now take baseline vitals, starting with her pulse. Remains 68. Her SpO2, 99 with the use of the oxygen intervention. Blood pressure. Blood pressure comes back at 120/80. Respirations come back at 20.
We are also going to take a BGL at the finger in here. Processing comes back at a 98.
We're now ready for our unit call. Unit call, this is 104, unit 104. We have a 35-year-old female patient that was in a car accident. Our general impression was that she had severe bleeding that was a life threat. We controlled that bleeding with the use of a tourniquet. Her baseline vitals were pulse 68, SpO2 99, respirations 20, and blood pressure 120/80. We'll continue to reassess. She was alert and oriented ×4. And what's our estimated time of arrival?
Next time around was 2 minutes. What else did we do?
We'll continue reassessing. We
Breathing.
controlled for any critical bleeding.
For breathing, we checked for proper ventilation, also oxygen therapy, which we did with the oxygen tank, and anything that may compromise the breathing. We properly positioned the patient for shock.
And we were treating for hypoperfusion due to the tourniquet.
We are also properly offering, make sure she has oxygen, she is supplying oxygen, that she's constantly good nasal cannula at this time.
You checked at the oxygen O valve.
Yes, I checked the O valve, make sure it was working properly. I checked for any cracks on or leaks in the oxygen tank too.
High priority patient.
I'm a patient. Every 5 minutes we will reassess, transfer via ambulance.
And we're good.